Glutaric acidemia is a rare metabolic disorder that affects the body's ability to break down certain proteins. In this video, we're going to delve into the details of glutaric acidemia, its types, causes, symptoms, diagnosis, and management. Glutaric acidemia is classified mainly into two forms, type 1 and type 2. Type 1 is caused by a deficiency of the enzyme called glutaryl-CoA dehydrogenase, which is crucial for breaking down the amino acids lysine and tryptophan. Type 2, on the other hand, is linked to a deficiency in multiple acyl-CoA dehydrogenases and can lead to a more severe presentation with various metabolic issues. This disorder is inherited in an autosomal recessive pattern, meaning that a child must inherit two copies of the mutated gene, one from each parent, to develop the condition. If both parents are carriers, there is a 25% chance with each pregnancy for the child to be affected. The incidence of type 1 is estimated to be around 1 in 100,000 births, though this can vary based on geographical regions and ethnic backgrounds. Now, let's talk about the symptoms of glutaric acidemia. Symptoms can vary significantly, but in infants, they often manifest during the first few months of life. Some common early signs include vomiting, poor feeding, irritability, and developmental delays. One of the most alarming symptoms may be the occurrence of acute metabolic crises, particularly following infections or stress. These crises can lead to encephalopathy, characterized by a reduced level of consciousness, seizures, or even coma. In addition, children with type 1 may experience movement problems caused by basal ganglia damage, which can result in dystonia or abnormal muscle tone. Symptoms in older children may involve neurological deficits and developmental delays that can become more pronounced with age. It's essential for parents to recognize these signs early, as prompt diagnosis and management can significantly improve outcomes. To diagnose glutaric acidemia, healthcare providers often rely on a combination of clinical evaluation, laboratory tests, and sometimes metabolic screening. Blood tests may reveal elevated levels of glutaryl carnitine, and urine tests typically show increased concentrations of glutaric acid. Genetic testing to identify mutations in specific genes can provide a definitive diagnosis, especially if there is a family history of the disorder. Once diagnosed, managing glutaric acidemia primarily involves dietary modifications. The goal is to reduce the intake of lysine and other protein sources that could exacerbate the condition. Often, patients follow a low-protein diet and may require a carefully formulated medical food to ensure that they receive adequate nutrition without triggering metabolic crises. In some cases, additional interventions may be necessary, such as supplementing carnitine to help excrete toxic metabolites. Regular monitoring by a metabolic specialist is crucial for adjusting dietary plans and tracking the child's growth and development. Families may also benefit from genetic counseling, which can provide support and information about the risks for future pregnancies. It's important to note that despite appropriate management, some individuals with glutaric acidemia may continue to face challenges, particularly related to neurological development. Early intervention programs focusing on physical therapy, occupational therapy, and speech therapy can be beneficial in supporting development and improving quality of life. Advancements in research are ongoing, and scientists are continuously exploring innovative approaches to better understand and treat this condition. Clinical trials for new therapies are being conducted, with hopes of improving outcomes for affected individuals. In conclusion, glutaric acidemia, while rare, poses significant challenges for those affected and their families. Recognizing the symptoms early and coordinating medical care can lead to improved outcomes. If you suspect your child may have this condition, do not hesitate to consult healthcare professionals for evaluation and potential testing. Thank you for watching, and please consider subscribing to our channel for more educational content on metabolic disorders and other health topics.